Hysterectomy, in simple terms, meaning removal of the uterus surgically, right? And the term hysterectomy means treatment for hysteria. So in the old days, somehow the medical fraternity believes that woman's hysteria can be cured by removing the uterus. And that's in the old days. But we kept the term, meaning removing the uterus.
And what are the common reasons for a hysterectomy?
The obvious reason to do a hysterectomy is cancer. May that be cervical cancer or uterine cancer or endometrial cancer, right? These are the obvious reasons, and we need to do a hysterectomy. But these are not the common reason for hysterectomy. The common reason for hysterectomy, in fact, are for benign disease and benign conditions, like fibroids, like heavy period, heavy menstrual bleeding, right? And those women who might have failed conservative therapy. So, in fact, in Australia, more than 90% of the hysterectomy were done for a benign indication, non-cancerous indication.
Are there different types of hysterectomy?
Yes, hysterectomy can be done in quite a few different ways, right? And that can be done as an open surgery, and that means a 15-centimeter cut, and like a cesarean section cut to remove that. It can be done laparoscopically through keyhole, and it can be done transvaginally, and they call laparoscopic assisted vaginal hysterectomy, meaning that so there are only 3 keyholes in the abdomen, but the actual fibroid, but the actual uterus, whether that contains fibroid or not, is removed through the vagina, so there's no big cut. And in more recent time, there is a robotic hysterectomy as well. That's what they call the single port, meaning that there's only one slightly bigger hole in the tummy to do the hysterectomy. Quite often that has to be the actual uterus is removed through the vagina as well. So this is how different types, different ways of removing the uterus. To answer your question about what are the types of hysterectomy, I think what you're trying to say is, to ask is, what are the different kinds of hysterectomy? Now we talk referring to a total hysterectomy. That means the whole uterus is out. And there's also total hysterectomy with together removing the ovaries and the tubes as well, and that's called total hysterectomy with bilateral self-injectomy, that's removing the tube, and bilateral ovarectomy, that's removing the ovaries as well. And this is a surgery typically done for cancer. That means everything out, right? And for benign disease, we tend to leave the ovaries behind. We just remove the uterus, and typically with the tubes as well, because we know that ovarian cancer typically come from the tubes. So there's no point removing the ovaries, but just remove the tubes, should be fine. And that can be done as a total hysterectomy, which means the uterus, the tubes, and the cervix, everything removed. Or a subtotal hysterectomy, that means leaving the cervix behind. There is a perceived advantage of leaving the cervix behind for a few perceived reasons. Number one is they think we can leave the pelvic floor intact because the ligament tend to be attached to the cervix. And also for perhaps some women believe that maybe sexual function is better with the cervix behind as well. The disadvantage is that you still have to do your cervical screening test to make sure that there is no development of cervical cancer. Right? If a total hysterectomy, then that cervical cancer risk is removed completely.